So, like I said, we work to build power for kids here in California. Most of my work is focused on the Medi-Cal program, so that's what I'm going to talk about today. So Medi-Cal is California's version of the Medicaid program. Medicaid is a public health insurance program for children, adults, and seniors, and it is jointly financed by the federal and state governments. But each state administers its own program separately. So it all looks a little bit different, and that's why we call it Medi-Cal here in California. But like I said, it's a joint financing arrangement with the federal government, and that arrangement has been around for decades. It's now under threat by the current congressional plans to slash Medicaid funding. So to be very direct, Medicaid healthcare cuts hurt working folks, children with disabilities, expectant mothers, and seniors in nursing homes, but no one will be spared. Healthcare costs will rise, and access will shrink for everyone. Medicaid, like I said, known as Medi-Cal in California, is a lifeline for over 15 million Californians, providing essential care to California's families, seniors, children. 40% of births in the state are covered by Medi-Cal, helping kids get off to a healthy start. 5.5 million kids in this state are covered by Medi-Cal. That's 1 in 2. So half of kids in the state are covered by Medi-Cal, so it's huge. Medi-Cal for kids and teens covers comprehensive services, including preventive care, screenings, behavioral health, dental care, emergency care, and much more that kids need to thrive. We know that kids with Medicaid coverage have opportunities to succeed because kids in Medicaid do better in school, miss fewer school days, are more likely to graduate from high school and go to college, have fewer emergency room visits and hospitalizations as adults, and earn more money as adults. Medicaid dollars are the largest source of federal funding to California and makes up 1/5 of our state budget. Cuts to federal spending would leave the state with an enormous hole to fill. Last week, the House and Senate agreed on top-line contours of a budget agreement to make deep cuts to federal health spending. Right now, they are on a 2-week recess, and once they get back, the committees in charge will decide how, over the next couple months, they will decide how they're going to slash $880 billion in the next 10 years. Most of that is going to come from Medicaid because there's nowhere else to make those level of cuts. And this is going too far, too fast. Reckless cuts to critical programs in Medi-Cal would do nothing to make healthcare more efficient or more affordable. In fact, cuts to federal Medicaid spending leave the state with impossible decisions to make, to make up for the loss of federal dollars. If Congress cuts $880 billion over the next 10 years, California would lose roughly $13 billion next year. And just as a source of comparison, there were about $12 billion, over $12 billion spent on Medi-Cal just here in Orange County. So essentially, if we wiped out the entire Medi-Cal program in Orange County, is what the state could face next year. These are impossible cuts.
Michael, can you repeat in 2024?
I would have to double check that number, but I can
Okay,
give you that.
it could
Yeah.
be fiscal, okay.
Yeah. So the congressional plans to slash the $880 billion from Medicaid nationally will not only compromise the health of the 15 million Californians that depend on it, but will destabilize the healthcare system for every Californian. Health clinics and nursing homes will close and healthcare workers will be laid off. I just saw an article today about how a local clinic is going to be scaling back on services due to loss of federal grants. That makes access to care less available. Hospitals would close, forcing people to travel further for care, and emergency rooms will be even more crowded. Healthcare will become more expensive for everyone if people are not covered, and as families are forced to pay more out of pocket for care, providers raise their costs to compensate for fewer Medi-Cal dollars, and businesses have to pay more to insure their workers. So in closing, I just want to reiterate that healthcare cuts hurt all of our communities, and the Medicaid cuts being considered in Congress will terminate healthcare for millions of Californians, including children, families, seniors who depend on nursing home care, people with disabilities, people fighting cancer, veterans, and home care workers. My message to our elected officials is simple: don't cut Medicaid. Thank you.